Zachary Goldberger. I'm an associate professor of medicine at the University of Washington School of Medicine.
And you practice at?
I'm in the Division of Cardiology at Harborview Medical Center. Yeah, so the broken heart syndrome is actually a form of cardiomyopathy, which is a weakening of the heart muscle. Typically we see it in middle-aged women, 60s to 70s, who have had some sort of emotional or physical stress. Loss of a loved one, hardship economically. And then what they would do, what usually happens is they present with chest pain, shortness of breath. They go to the emergency room and they would have electrocardiography changes, lab values that are all very much concerning for a heart attack. And only after the heart attack has been ruled out are we starting to entertain this diagnosis of this broken heart syndrome, which is more medically called stress cardiomyopathy. Yeah, it's definitely real. It's a weakening of the heart muscle that's often precipitated by people who have undergone physical or emotional stress. Typically it's very short-lived and transient, but it can persist and can cause serious pathology. It's actually very difficult to diagnose. It presents just like a heart attack would. People present oftentimes with chest pain, they come in shortness of breath or having passed out. And when they present, they also oftentimes have ECG changes that look like a heart attack as well. We'll see that the patients will have this profound electrocardiography change or a profound abnormal wall motion on their ultrasound, and days later that's all gone. And these abnormalities in ECG can change from hour to hour. It's quite remarkable, and then we'll echo them again a week later, and that characteristic wall motion they have, where oftentimes the apex of the heart is ballooned out and the top of it's kind of very hyperdynamic or squeezes a lot, that change actually goes back to normal within days to weeks. Anytime someone comes in with this and they have this pattern, I would always want to echo them again. But typically it does affect women. And the older you are and the more heart failure you have, the more serious the outcome can be.